Alongside the United Nations General Assembly meeting this week, there is a push to increase funding for the global fight against infectious diseases, including AIDS, tuberculosis, and malaria. Most countries, led by the U.S., have signed on, but the United Kingdom is a holdout. As special correspondent Dr. Alok Patel reports, with government budgets tightening, there is concern that life-saving programs might be scaled back. This story was produced in a partnership with the Global Health Reporting Center.
This is a story full of big numbers. Around the world, more than 600,000 people are infected with malaria every year. Nearly 40 million are living with HIV, and nearly 2 billion people are infected with tuberculosis. Nearly 1 in 4 people on Earth. This is not to make you feel hopeless, but to understand the scale of the challenge.
We work across around 120 different countries.
Peter Sands is the executive director of the Global Fund in New York for a final fundraising push.
We work with governments, we work with civil society, we work with the private sector. Most crucially, perhaps, is we work with the people and communities who are most directly affected.
The fund emerged from the special UN session on AIDS in 2001. Major backers, including the Gates Foundation and the US and British and French governments, saw themselves as filling a crucial, unmet need. Since its founding, the fund has poured more than $55 billion into programs that pay for medicines, training health workers, and preventative measures like mosquito nets.
Since the Global Fund was created, we have saved 50 million lives.
20 years ago, fewer than 1% of Africans with HIV were being treated with antiviral medication. By last year, that number was up to near 75%, driven by international aid, including more than $100 billion from the United States, money that came through the Global Fund and later through PEPFAR, the U.S. program to fight HIV in Africa, which Eric Gooseby led from 2009 to 2013.
It wasn't until 2002 that there was a first response that took money that wasn't right there in the country and made it available to put it toward a response.
South Africa is just one country that relies heavily on the Global Fund for programs like HIV prevention.
And people don't want to be seen at the clinic because everybody knows that if you go to this donor muscles and so you are HIV positive. Yeah.
Until just recently, Zaniwe Mavubengwana worked as a community engagement counselor at a clinic in Masi, South Africa. She herself tested positive more than a decade ago, a diagnosis that ended her dream of becoming a doctor.
I'm into helping people and making a difference into their lives. That was my goal. And I even almost had a scholarship, but then life happened.
But for 2 decades, Zaniwe has been able to raise a family and keep working, thanks to life-saving antiviral medication.
First and foremost, antiretrovirals are miraculous.
Linda Gale Becker is one of the world's top HIV experts.
Those individuals, young people, would be dead today if they hadn't been able to access antiretrovirals and stay on those antivirals.
And yet Dr. Becker says this success is now in jeopardy, a casualty of shrinking budgets and fallout from the COVID-19 pandemic.
You know, that we took our eye off the ball and we are paying the price for that.
The Global Fund put more than $4 billion into fighting COVID, but it also put a major strain on resources that has yet to be made up. HIV cases have continued to decline during the pandemic, but more slowly. And in sub-Saharan Africa, fewer people have been able to access treatment. TB and malaria suffered even bigger setbacks.
For the first time in the history of the Global Fund, we saw reversals of hard-won gains across all 3 diseases.
We have to recognize that there are 29 million people accessing antivirals today. If their antiviral therapy stops, their disease comes back, and it comes back in full force.
A halt to these programs could lead to drug resistance and renewed spread of disease.
We see the impact of TB, HIV, and malaria coming back in full force. Not having a global fund at this point would be beyond devastating.
In the region, TB, malaria, and HIV are all among the top 10 killers. It's home to more than half of the 38 million people around the world who are living with HIV. Women make up nearly 2/3 of new cases.
Because also, power differentials mean that they're not able to request safer sex measures.
Despite all Zanyewe's efforts, her daughter, Tiny, was diagnosed with HIV just last year.
I was quite disappointed, I must say. I felt like a failure. It's like I did not do as much as I would have done.
And now, Tiny is seriously ill with TB. Her partner just died of it. And Zanyewe, pregnant herself, is caring for their baby, who also has TB.
I think the hardest part about it is that women are not empowered.
Kele Motchabi is HIV negative and signed up for an HIV vaccine clinical trial because she's afraid and says she can't rely on her boyfriend to practice safe sex.
We are made to think that we cannot say what we want, we cannot express our feelings, we cannot get what we want because we are women. It's like we're strengthless, we are powerless, we don't have anything to say, we cannot say anything. It pisses me off.
To help these women and billions of people around the world, Peter Sands says a revitalized global fund is critical.
The Global Fund is 2/3 of global funding for malaria. We're over 3/4 of global funding for TB, and we're 1/4 of global funding for HIV. So if we want to beat these diseases, if we want to save those lives, then we have to hit this target.
Still, a focus on individual diseases is not enough, says Eric Gooseby.
Do you think it's still the right approach to focus on 3 diseases, or do you think it's beneficial to kind of focus on healthcare systems as a whole?
Well, I've been a disease-specific person my whole career, but I've seen enough, and now I believe know enough to say that it really is about a health system and your ability to strengthen that system so it can deal with any disease. And we need to do it more and more again and again for not just 3 diseases, but for really all diseases.
The future for Kele, Zanyewe, and others like them may depend on how much world leaders take that message to heart. For the PBS NewsHour, I'm Alok Patel.